think it's just most people, or we always mention to patients, it can't be cured, because that's always one of the questions they do come into our clinic and ask, can it be cured? And we're, no, unfortunately can't. But it can be very well maintained with the proper treatment, and we focus on using the proper treatment to maintaining the quality of life, at reducing their symptoms. Um, yeah. I'm not as good at this. I'm sorry.
No, you're doing
great.
you're doing absolutely phenomenal.
I don't have. I mean,
It's so funny how we tend to be hardest on ourselves. Like, really, no, you're doing it.
Yeah,
you're
I have
doing
everything
awesome.
scribbled here.
No, absolutely. You're doing great.
I mentioned that for the medication pharmacotherapy too, and I think that goes with the COPD clinic too, to explain to the patient not only, you know, this is what your puffer looks like and this is how you take it, but also this is why you were prescribed this medication, what the usage is. So if they understand why they're taking it, I think they have kind of a tendency to take it maybe more, because sometimes they just think, well, they gave me puffers, but they don't even know what the puffers do. You know what I mean?
Yeah, actually, that's true, because whenever we do our puffer teaching at our clinics, is we do explain the why to the patients. We use a picture of their lungs or their diseased lungs, and we explain exactly how the puffer works in the lung, whether it's to relax a muscle, whether it's to prevent a muscle from tightening, or whether it's to get rid of the redness inside of the lungs. So we use a lot of that, and then when it becomes clear to the patient why they're taking it, they're better at taking it because they understand the purpose behind it.
Yeah, you know, I like the analogy of diabetes, that people don't think about COPD in terms of like the chronic aspect of it and how it does need treatment all the time. Yeah, like a diabetic has to constantly take insulin, right? I'm going to use that analogy. Like,
that's fine. I use it with all my because the patients sometimes, because they'll say, well, I took my puffer when I was short of breath, and then I wasn't short of breath, so I didn't take it. And I go, well, and often, so diabetes is one of them, or high blood pressure I love, because I go, I see you have high blood pressure. And they go, yes. Or I take medication for high blood pressure. I said, did you take your blood pressure this morning? No. Well, how did you know you were supposed to take your pill? And they go, well, because the doctor told me to. And I go, well, that's the same thing for your COPD. Even if you're having a good day or a bad day, you're supposed to take your medication to maintain that. Yeah. Not just on depending on
the
how
days that you feel like you're out of breath. Yeah.
Just like you wouldn't decide if you took your medication depending on what your blood pressure was that day.
Yeah.
And we also speak about that by taking your puffers every day, it prevents the disease from progressing as quickly as if you're not taking it, prevents exacerbations. So reduction in taking it.
Yeah.
That's awesome. And how about providing self-management strategies and behavioral support? How does that help the patients manage their exacerbations?
I find education goes a long way. Education has to be tailored to every patient, so we try to make it very unique for every patient, and I find it just understanding at the basis of it helps them to manage better their symptoms and their disease, and also them knowing that we're there to help self-manage, to know that they have a bit of a support.
Yeah, it's amazing, and that, like, I truly, you know, think that what you guys do is just absolutely incredible, because it really is like such a, you know, personalized kind of disease in terms of where everybody is at in their journey of COPD, right?
And we do a lot of explaining, because some patients feel like they're very isolated in their disease, and we kind of help put everything in perspective a bit for them, that yes, you do have it, but you know, there's treatments now, and then we have this program to offer and this program to offer, whether it's a rehab program or action plans, or just even access to the clinic where we can do a breathing test if ever. Sometimes the patient feels comfortable doing a breathing test because they're unsure. I don't know. They enjoy coming.
Yeah.
And talking about it.
I can definitely see the isolation aspect. You know, a lot of people that we talk to, they are, you know, isolated. They're older. They don't have access to the transportation. They're on fixed income, so they can't really pay as much money to come in to do the things. So yeah, again, it's amazing what you guys do. What is the importance of education and support around reducing risk factors for COPD?
I guess my view of it is it doesn't take always a ton of puffers. It doesn't always take, I have to give up smoking my 2 packs a day. Sometimes it's just a bit about harm reduction, just to kind of maybe do things better than what we were doing. So maybe smoking a bit less, walking a little bit more. If patient has triggers, whether it's to sense and cleaning up little things, as opposed to completely doing a 180 in their lifestyle. And I find if we can kind of educate a little bit on that, then they're more apt to make these little changes as opposed to making a huge change. It can be very scary. So by putting that kind of stuff in perspective, because not everyone is capable of making these big changes, you know, when some doctors will say, oh, you're allergic to dust mites, let's rip out the carpet. It's not always feasible.
Plausible.
Right? So, you know, just helping them put little things into perspective and making little changes and telling a patient these little changes can add up and make a big change or can help in the long run. Sometimes you don't have enough emphasis on the little changes.
Right.
Yeah.
Yeah, I could see, like, you know, you have a patient, let's say that they've smoked for 40 or 50 years, started when they were a kid, you know, maybe mental health issues, maybe, but then you introduce this crazy anxiety situation for them, like they have this disease, this, you know, a chronic disease, and then you're saying give up the one thing that's, you know, you've used as a crutch for the last.
And I mean obviously we would always love for them to quit smoking, but we realize it's an addiction, it's not always possible. So I find just helping the patient understand that, you know, unfortunately you're a victim of this addiction. The people to blame for this are the big tobacco companies, you know, and unfortunately you're just a victim of it. You know, it kind of helps them take the weight off their shoulders, thinking that they caused this, kind of like what Dr. Williston was saying.
Right.
You know, they feel guilty. They feel like they deserve this, and it's not fun for them. And
yeah.
So
I was thinking with the forgot to mention that too when I was talking about the where has it been with the risk factor reductions. I think the COPD clinic too is an excellent place for them to remind the patients on not just smoking cessation but annual influenza vaccination. No, I forgot to.
Absolutely,
I just forgot to, so I thought, yeah, you might as well mention it because it's a way for them to say, you know, did you get your, and what is the importance of the flu shot and things like that. Did you get your pneumococci vaccination as well? And yes, working on smoking cessation, but also other trigger avoidance, like you already mentioned. So, you know, it's a slew of information that they don't always necessarily get in a 15-minute visit with their family doctor, right? Where the clinic can kind of take a global approach of the disease and not just talk about pharmacotherapy, but all the other aspects. You know, you guys are really good at that.
That's true, because even I was doing follow-ups this morning with patients, and we were talking about the flu vaccine, and a lot of it is patient belief. So if anything we learned about education with patients is you can't change their beliefs, but at least you can, or at least we as educators, we can kind of at least give them the facts as we know it, and then let them make kind of an educated decision based on that. You know, some people have their beliefs about the flu shot. Sometimes it's unfounded. It's just from their own experience, or it's from what they hear others say of it. So
I didn't get a flu shot until I was pregnant with my first child, so 8 years ago was the first time I got a flu shot. I'd never been sick with the flu, really. I mean, I had one bout of like 24-hour sickness one time, and prior to that, the first year I got a flu shot, I got sick. I'm not even joking. Like, but you know that you get that.
It's the association.
You get that kind of association in your mind, and then you're like, wow, that's the first time I ever got a flu shot. That's the first time I ever got the flu.
It's funny because I had a patient this morning who told me that he got his flu shot this year, and he was sick like the night of. He started getting sick and fever and blah blah blah.
And how realistic is that?
And I said, yeah. And he says, well, every time I get the flu shot, I get sick. Or that's what his wife said. Every time he gets his flu shot, he gets sick. I said, okay, I can understand that that's your thought process. I said, but I'll tell you the other version of the story. I say, I get my flu shot every year and I never get sick. So is my argument better than yours? And they're like, no, exactly.
And then what I explain to patients, because I had an experience where I was babysitting my friend's kids on the